Hi everyone, this is Dr. Stefan. Welcome to another video. I've got a comment from someone who's obviously really frustrated with having severe COPD, and they are suggesting that the treatments only manage symptoms. They do nothing to cure the disease. And if you ask a doctor what causes the disease, they don't know. However, many will blame smoking. And myself as a doctor, I also unfortunately tend to blame the smoking in many situations. I don't blame the patient for smoking. So that's a very important distinction. And I think a lot of doctors will make that distinction. Maybe it's not as clearly stated sometimes, but we actually blame the cigarettes. We don't blame the person who's using the cigarettes. And we just hope that there would be less and less of that, because I think in many situations people don't have much of a choice. They end up starting smoking when they're really young, when there's a lot of influence from older kids, from adults, from people in the family, friends, society, commercials, all kinds of psychological nudges that get people hooked on the cigarettes, and then it's really hard to quit after you've been smoking for 10 years, because especially if you've grown up with smoking in your formative years, it's really hard to quit. It's part of your life. Some people, actually, it's part of their identity. I think they would be completely different people if they didn't have a cigarette in their hand. And I'm sure you have some of these friends yourself who, they're very calm and chill when they have their cigarette, but otherwise they're a little bit different. So, it's just something that becomes a part of us, an appendage of, for lack of a better word. But yeah, we do blame the cigarettes, because I really wish that we would have a future in which fewer people would smoke, or even if they want to smoke, they just do it as, here and there, as a thing that they do, but not an addiction. And there's many studies into this, that a lot of people with severe lung disease actually want to quit, but they can't because the addiction is too strong. And that addiction has a psychological component, has a social component, has a physical component. And even though the cigarettes are making them ill, they cannot quit, because there's so many components, so many aspects to it, that you cannot just tackle them at once, especially if you're unwell. So I just wanted to make this point, that if your doctor tells you to stop smoking, it's because they want the best for you. They want the best for you, because in many situations, that is the cause for a lot of health problems. And it may be hard to quit. I do get that. And there may be people who have predispositions to react worse to the smoke than others. Granted, we all know these examples of that one person who smoked all their lives. They had a crazy life and they still lived to an old age, and they were fairly healthy until they passed away. We all know these stories, but they are so rare. And for us, in our profession as medics on the other side of the fence, we actually see the opposite. We see that most people who have very severe conditions, especially respiratory conditions that we see in our clinics, in our hospitals, they've actually smoked for many, many years. So we see the other side of the bias, if you want to put it that way. So not blaming anyone who's smoking, but I'm just saying if you do have severe lung disease, really consider quitting. It's very difficult, but it can be one way of stopping that condition from getting worse. That's all I'm saying. Hopefully this is helpful. If you want to have a go at me in the comments for saying that, please go for it. But honestly, we never really blame the person who smokes. We blame the smoking. And the smoking is not the person. Smoking is not you. Thanks for watching. All the best and good health.